You go to see a therapist because you're an emotional mess. They're the professional. They're supposed to know what they're doing. They're supposed to know how to help you. And although most licensed therapists are caring, thoughtful people who really will help you, there are a few bad apples out there. Sadly, quite a few. In this video, I'll describe two bonehead approaches that seem super common, especially among therapists that you see on social media. In future videos, I'll let you know about others. I'm Dr. Stephen Reedboard. As a psychiatrist and psychiatric educator with eons of experience, I challenge misleading or oversimplified messages you see everywhere on social media. If you like what I'm doing here, please like this video and subscribe to More Than Meds. The word psychotherapy seems kind of formal and old-fashioned these days. It might conjure up an image of a Freudian psychoanalyst with their patient lying on a couch. Or maybe it gives you a different image, a precise protocol-driven series of sessions laser-focused on a particular psychiatric disorder like OCD, obsessive-compulsive disorder. Maybe that's one reason people shorten the word psychotherapy to just therapy. It sounds friendlier, although it's also fuzzier, something that I talk about in this video right here. The truth is, most therapy is not Freudian psychoanalysis, and it's not protocol-driven sessions laser-focused on a psychiatric disorder either. It's a client and a therapist sitting up in chairs talking. Certainly nothing wrong with that. That's what I do in my practice. But what do they talk about? That's the key issue. The famous first line of the novel Anna Karenina by Leo Tolstoy gives us a clue. It reads, "All happy families are alike. Each unhappy family is unhappy in its own way." Likewise, all good therapists, the kind we can still proudly call psychotherapists, are all alike. They pay close attention, they're invested in the process, they're curious about their patient or client, they listen well, they're empathic, they're curious, they're connected, they're adaptable, and maybe most important, they're focused exclusively on the person in the room with them or on the screen with them, the one client or patient they're trying to help. They're trying to focus exclusively on how they can best help that person live a fuller, happier, more meaningful and satisfied life. In contrast, each bad therapist is bad in his or her own way. And today I'll talk about two of those ways. The therapist knows ahead of time how to help the client. Aren't they smart? Everybody just needs to get in touch with their inner child. Everyone needs to embrace their warrior spirit. Everyone must relive the trauma of their own birth. Everyone should turn their frustration into political action. Everyone must learn to forgive. Everyone should stop their psychiatric medications, which are just poisons sold by big pharma to keep everybody a zombie. Or everyone should take psychiatric medications because all emotional problems are chemical. Everyone should hug trees and commune with nature. We should all let go and let God. Everyone's healthier when they smile, so smile, damn it. There are warehouses full of self-help books that say, do this and you'll be happier. I have no beef with a book that has a focused perspective like that. Maybe you'll read it, you'll learn something, and you'll incorporate the teachings and the insights it has into your complex, multifaceted life. That's great. But it's a whole other story if you get simplistic, one-dimensional advice from your individual therapist, your one-on-one therapist, who's supposed to be focusing on you specifically. Isn't the whole point that they're helping you specifically with your complex, multifaceted life and not people in general? If you wanted general advice, you could just read their book. For one thing, that would be a lot less expensive. So-called therapy that treats you with generic, meant-for-everyone advice is not really psychotherapy. It's lazy and it's incurious, which is a great word. could look it up. It means lacking curiosity and interest about you and your subjective experience. But this can be tricky. Lots of clients or patients would love to have a simple answer to their problems. So this approach is seductive. The public really craves it until they're in a session with their individual therapist and realize that they're just in take-a-number therapy. It's not for them specifically, it's just for their therapist to apply their pet theory or their favorite approach to the next person on the assembly line. That's great news if it's all you need. Not so great if you'd like to be treated as a unique individual. You might end up feeling dehumanized and even worse than you felt before. Number 2, the therapist likes to talk. Again, many clients or patients are repelled by the blank slate stereotype of psychoanalysis, where the analyst says little or nothing for most of the session. Now, I have to say that can be a very valuable approach to deeply understanding what's going on with yourself emotionally. I think it's very valuable, that kind of psychoanalysis. But the truth is, most people don't want that kind of treatment, and fortunately, most therapists don't provide it. It's much more of a dialogue, a give and take in the session, not a blank slate. Of course, the focus is on the client, with the therapist mostly listening, client doing most of the talking, unless it's a bad therapist who likes to talk. This comes in several forms. Occasionally, you'll run into a therapist who thinks it's useful to lecture their client with a complicated theory about what's going on in the client's mind. Unfortunately, real psychotherapy isn't intellectual. Getting quote-unquote insight in therapy sounds like you're learning something intellectual about the way your mind works. But actually, that's a misunderstanding. Useful insight in psychotherapy is more of an emotional experience, actually. It's not a dry set of facts. Nobody improves or feels better in psychotherapy having listened to a lecture by their therapist about how their mind works. No one gets better by having their therapist recite or explain their dynamic formulation. What's a dynamic formulation? It's something that we therapists use among ourselves to help understand our clients or patients better. I describe what that is in this video right here. Point is, it's not something that you recite to the patient. It's something that helps the therapist understand what's going on. More often, talkative therapists believe they're offering valuable advice. Isn't that generous of them? What they're really doing is repeating some generic bit of wisdom they learned online. Look at the bright side, recite gratitude affirmations every morning, confront that coworker and tell them what you really think is going on, tell them what's what. Or worse, they just talk because they like to hear themselves talk. They appreciate having a captive audience, the patient, so they like to tell jokes or show off their brilliance. This feeds their own narcissism, their own pride in how clever they are. Or they disclose personal information about themselves in the mistaken belief that clients need this in order to feel like their therapist understands where they're coming from, which, by the way, isn't true. I've heard many stories of patients complaining that their therapist talked so much about themselves that they felt that their time was being wasted. That's a pity, isn't it? All of this wastes the client's time and money and effort, doesn't help them get better, doesn't help them learn new things about themselves, doesn't help them live a different, better life. It doesn't lead to lasting change. So today I've talked about 2 of the common ways that therapists do things that aren't particularly helpful, that I think you could legitimately say are bad in therapy. But there's a lot more where those came from, and I'll talk about more of them in coming videos. What's your experience with bad therapy and bad therapists? Tell me in the comments, and I'll reply with a substantial comment if your comment calls for it. Please like this video, but only if you really like it. Please subscribe if you have not already. And for more about what works and what doesn't in therapy, check out this video. I'll see you next time.